Hello, I'm Dr. Jacob Lonsdale, originally from outside of Salt Lake City, Utah. I've been here in Marshfield and at the Marshfield Clinic for 14 years. I trained as a pediatrician and also did some extra training in bone and joint medicine, or as a pediatric orthopedic provider. Together with my partners, we find it a joy and an honor to be a part of the Bardet-Biedl Syndrome Clinic, and we are just delighted to be able to help care for the bone and joint needs of all and any of our patients that come from around the world to receive care here. I look forward to seeing you and answering your questions and being a part of your care. Thanks.
Hello, I'm Kyle Salisbury, and I'm a genetic counselor here at the clinic. I work with BBS patients and just answering questions related to genetic testing and inheritance of BBS, reviewing test reports with them related to the different genes associated with BBS. I really enjoy being part of the BBS Center of Excellence, just getting to know patients a little better and meet their families that come with them. And I really feel like the clinic is a place where patients come to try to get answers and just learn more about BBS. And so I really enjoy being able to be part of the team that provides those answers for them and helping them better understand more about BBS. And the families are just amazing to work with, and the patients are always enjoyable to get to know. So I really enjoy being part of the Center of Excellence.
Hi, I'm Dr. Jill Milan. I'm a pediatric rehabilitation medicine physician. Our specialty has a motto: we help add life to your years, not just years to your life. I work specifically with pediatrics, but I see people throughout the age range if they have a condition that presents itself when they are children. I work with a team including physical, occupational, and speech therapists, as well as recreation therapists and child life specialists, to prescribe programs to either work around problems that people might have or train to become better at something that's difficult. I became interested in the Bardet-Biedl Syndrome Center of Excellence because of Dr. Bob Hawes, of course. He has a great passion for this population. We are all so excited that he's established this center, and so we can all share and learn more and gain knowledge about this specific genetic condition.
Hello, I'm Dr. Uzo Okori. I am a pediatric cardiologist by training and part of the cardiology service team here at the Marshfield Clinic Center of Excellence. I enjoy being a part of the Center of Excellence because I really love sharing information on how best to take care of patients, as well as learning from the family's experiences. Thank you.
Hello, hi, I am Dr. Anub Iqbal, one of the pediatric endocrinologists. I'm very fortunate to be part of the Center of Excellence for Management of Bardet-Biedl Syndrome. Children with Bardet-Biedl syndrome are at increased risk of developing various endocrine dysfunctions like thyroid abnormalities, hypertriglyceridemia, diabetes, hypogonadism, and obesity. So it is very critical that we screen for these conditions and identify them early. This ensures that we are able to keep them healthier and also improve their quality of life. Here, in the multidisciplinary approach, we are able to address all the patient's clinical needs with the help of the experts in each of those fields.
Hi, I'm Lori Bushy, medical social worker, and I enjoy being a part of the Center of Excellence because of all the amazing families I get to meet. It is truly a privilege to be a part of their journey in helping families access different resources and services and supports.
Hi, my name is Dr. Beto Daheli. I'm one of the adult endocrinologists. I've been part of the Center for Excellence to help the patients with BBS for the last few years. Dr. Haas has put in an excellent group. And the best part of the whole experience for me is to meet the family. we see these young people and the family come from all different parts of the country, and there's some who come from outside the country as well. There's a lot of unknown for these families about the disease, and they truly cherish some of the information they get from our team. And to be frank, we learn a lot from them as well, to know more about the disease and the challenges that they go through. And as part of the adult endocrinology service, I encourage them to ask questions about what are their concerns. And we do tend to see a wide spectrum of the disease, where some individuals have only one or two manifestations, but some of them have multiple symptoms that could be related to the hormonal imbalances. And I also try to give them an overview about what to anticipate in the years further down the road with the disease. And overall, it's been an excellent experience for me.
Hi, my name is Dr. Benjamin Hunter. I'm one of the neuropsychological specialists here at Marshfield Clinic who works with the BBS clinic. Primarily what I do is I conduct neuropsychological evaluations for our adult BBS patients in helping to identify neurocognitive functioning and participate in treatment planning, really to evaluate current cognitive abilities, develop an effective treatment plan, and really help to improve quality of life for these individuals who really require a special degree of care and service that we love to provide here at Marshfield Clinic.
Hello, I'm Sarah Kortenkamp. I'm a neuropsychologist who works with the Bardet-Biedl Syndrome Clinic. And my role is often to assess individuals, children or adults who come in, and figure out what are their strengths and weaknesses as far as their learning style, their academic skills, and what sort of supports and help they may need at home or in the communities. I often provide recommendations to schools for supporting children's learning, or provide documentation for guardianship or adult services that may be needed within their communities. I love meeting patients from all over the country and, in fact, all over the world. And my favorite part of working with the BBS clinic is how much I've learned from the patients. So if you read in a textbook or in a journal article about BBS, or really any syndrome or diagnosis, you might get the impression that everyone presents kind of the same. But in real life, it's so interesting to see the range of abilities and interests and behaviors that are just as wide as in any other group we work with, or any other group of the population. And the fact that my job allows me to highlight and emphasize the positives and those individual differences is very exciting.
So my name is Katya Kiefer, and I'm a clinical neuropsychologist at the Marshfield Clinic. And so what a neuropsychologist does is assessment of cognitive abilities and also everything that could potentially interfere with thinking abilities, things like mood, other psychiatric symptoms, sleep, and nutrition and other kinds of things. And so we do quite extensive assessments for these things and typically spend several hours with patients. I graduated from the University of Iowa, and then I completed a 2-year fellowship at West Virginia University, and I've been with the Marshfield Clinic for the last 3 years. And prior to coming here, I had actually never had experience working with individuals with BBS or their families, and so it has been a great learning experience for me, developing expertise in this area and also participating in some research as well. And so it has been just a great pleasure and privilege working with patients with BBS and their families.
Hello there. I'm Dr. Hema Murli. I'm a pediatric neurologist. I'm also a sleep medicine specialist. I have been part of the Bardet-Biedl Center of Excellence at the Marshfield Clinic Health System since the beginning, working with Dr. Bob Haas and a large group of other providers. It has been an immense pleasure and a great source of pride for me to be a part of this group, working collegially with all of these specialists to take care of these children with Bardet-Biedl syndrome, addressing their neurological issues with regards to concerns such as delays in development, speech delays, autism spectrum disorder symptoms, and learning issues, and also to be working with their sleep issues such as sleep apnea, difficulties when falling asleep, difficulties in staying asleep, and so on, most commonly. It has been wonderful to see these children grow and bloom over the years that we follow them, and we hope to be part of your lives for a long time. Thank you very much.
My name is Jacqueline Velasco. I am a pediatric endocrinologist, and it is a pleasure to be involved and part of a team who cares for children and teens with Bardet-Biedl syndrome. Because we know that the syndrome is associated with endocrine issues or concerns. Okay, as an endocrinologist, I monitor development of insulin resistance, which is when the body makes extra insulin to bring the blood sugar levels in a normal range. Okay, insulin resistance is also a risk factor for developing metabolic syndrome when they are older. Okay. Those boys who have BBS may produce less or decreased amount of testosterone, which we call hypogonadism, and may need replacement. So these are things that we monitor for them. For girls, they could be at a higher risk of developing hormonal imbalance called PCOS. So this is polycystic ovarian syndrome, and this is a common condition wherein too much androgens from the ovaries, okay, will give signs like excessive body hair growth, severe acne, and menstrual irregularities. We also monitor for structural genital abnormalities in girls who have BBS. 20% of BBS adults are found to have abnormal thyroid levels, which we call subclinical hypothyroidism, and so we monitor them for this. We are excited to be part of the team, and we hope to see you here in the Treatment Center for Bardet-Biedl Syndrome in Marshfield. Thank you.